And I know you also have a relationship with the Casper Surgical Center.
Yes.
And what kinds of instances do you find where you have a child at the surgical center?
Well, I think the reason both of us are happy to be pediatric dentists, our passion is to make dentistry not scary for kids. And, we all know adults that are scared to death to go to the dentist. I mean, that's worse than anything. And so I think my goal, and I think Everett's too, is, we want to make them good dental patients for the general dentist when they go, right? So, the problem is we don't have magic fairy dust in our office. We wish we did, but, we get a lot of referrals from general dentists that this kid won't even sit in the chair and they're screaming and they're crying, And so, we do a little bit of sedation in our office, a little. But, it's dangerous when you're playing with a lot of drugs in children. So we are so lucky that we have our Casper Surgical Center that we can take our patients there. We have amazing anesthesiologists in Casper that take care of the child for us. They put them to sleep, and then all we have to do is do our job. And, so the primary thing is, that's all we have to do. But the primary thing is, we want to protect these kids' psychological side of the dentistry for when they're older. And if you have a 3-year-old with 20 cavities, which we see all the time.
Yeah, no kidding.
All the time. Maybe even younger. I mean, we see 2-year-olds with all 20 baby teeth are bombed out. Mm-hmm. And you have to pull teeth. You have to put crowns on teeth. You have to do, baby root canals, we call them, things like that. That's inhumane to make a child that's that age. I mean, they're not capable of sitting and behaving for that. So, we feel very blessed that we can go there and have it be a safe environment, even though general anesthesia is scary. Obviously, for the parents, it's hard. Parents cry. I mean, it's hard. But, the surgical center is great. Their kids, in our opinion, are being taken way better care of there than if we were to try to do something, we would never do that. And so we feel very blessed that we can go there. So in addition to that, we also, Everett mentioned earlier, we do a lot of special needs patients. Can be way older, in their 30s. And, again, they're not capable of cooperating in office. And sometimes it's not safe for us or them to try to hold them or restrain them to do things. So we do a lot of that. Sometimes those kids, we just go and just do cleanings, thorough cleanings. We go there, but it's a much better environment